Been performing tummy tucks for about 15 years. Tummy tuck is one of those procedures where people, quite frankly, are tickle pink. It is addressing areas that cannot be resolved with diet, exercise, much of anything other than, quite frankly, getting rid of the excessive heavy tissues. Ideal candidate is that individual who has excessive tissues that are hangy, that are bothersome, clothing not fitting well, individuals who maybe have had surgical procedures with tethering and scarring such that it creates irregularities, if you will. Individuals following pregnancies, of course, who may have a lot of residual laxity of tissue that, again, is not attractive nor comfortable, where in many cases clothing just doesn't fit or is irritating. These are great candidates for a tummy tuck. Ideally, I'd like to see someone close to their goal weight, and they're, of course, going to be the best candidate to ultimately do the tummy tuck. That does not exclude necessarily someone who may be struggling and may not ultimately achieve a given goal weight. It doesn't mean that they absolutely have to, because the tummy tuck is addressing fundamental structural resupportive tissues. A lot of the tummy tuck is supporting the abdominal wall structures where we get solid support that may have been lost and really is not very much a weight-related scenario. Getting rid of excessive hangy skin tissues is also not necessarily a weight-related issue either, so it doesn't exclude an individual. We really try to place the incision very low down. I try to really look at a very low panty line type of incision. This is generally very well concealed. We take a lot of effort to make that incision as absolutely nice as possible. Many individuals who the healing can be spectacular and over time becomes a very fine line. The tummy tuck recovery is generally not too bad. Honestly, not as bad as perhaps some of the internet sites might make it sound like. My own patients often really do not have that much discomfort. Interestingly enough, of the pain medication we give, most of my patients only use something for a few days, honestly not more than that. We have individuals who are back to fairly normal activities within a week. I have example would be nursing staff where I did perform a tummy tuck and working a week later. So it can be fairly quick in terms of recovery, although obviously not perfect for a few weeks. Tummy tuck is going to range anywhere from $9,500 to about $11,500, and it's going to be related to obviously degree of tissue. Someone, let's say, who's had massive weight loss and has a huge amount of excess tissues that do extend the time and the complexity of the procedure, may be a little on the more expensive side. The typical tummy tuck is more in the $9,500 to $10,500 range. Basically, having analyzing what are your concerns, clothing fitting well, where am I in terms of my weight, what are my plans and goals, am I at a goal weight, is that something I want to work for? Those are some of the questions we would be exploring and discussing.